traditional rulers, religious leaders, youth leaders, ambassadors, women. We had champions. So it just clearly showed us the need to make sure that we are projecting it to Nigerians that this responsibility for preventive health and for health promotion lies on everyone. Because when we have a healthy nation, we actually would have a wealthy people.
Yes, health is wealth. I told you guys from the start of this, health is wealth. Now let's move on to this other arm of this conversation. Now, as we are aware that the health promotion slogan is ensuring health literacy for all, which was the slogan for the 3rd National Health Promotion Conference. Can you tell us the key challenges in ensuring health literacy for all, like, because the entire campaign is for everybody, it's not just for the government, like she said, and not for a particular sector. Can you tell us the key challenges in ensuring health literacy for all and your key recommendations in mitigating these challenges?
Okay, thank you very much. As you said, health promotion is we are trying to ensure the health literacy for all Nigerians. So the major key, the key challenge we have is the mindset. People's mindsets are not tilted to health promoting health. Rather, it's about management. It's about curing. So that is what we are facing now, and that is what we are trying to educate the public. That preventive is more cost effective. It is more reliable, because that's you do it yourself. No one is telling you what to do, but you go ahead to do it. So we want a population, society where people now focus on preventive health, focus on health promotion, not feeling like it's a normal thing.
It should happen.
But people being intentional about promoting their health.
Right, so for me, I think the key highlight for that National Health Promotion Conference is a clarion call for concerted effort between government and implementing partners and everyone else to begin to pay attention to preventive health other than curative health, and even place it in today's economy. I mean, you know how much you were buying malaria drugs before, and how much it is right now. So, so it's a moment of our reawakening of consciousness for people to begin to pay attention to their health before it deteriorates to the point of treatment and going to the hospital. And that's one thing to take away from me from that conference, that everybody came together, and the fact that government was able to mark that day, May 29, October 29th, as the Health Promotion Day is remarkable. I mean, it's never been done before here in Nigeria. So that goes to the consciousness of the people to now begin to know that, okay, let's do something, let's begin to work together to actually promote preventive health in Nigeria. And as partners, that's also what we do in our various organizations. We have robust teams of social behavior change communication people who are in the field, trying to make people to begin to take their health seriously.
Okay, now let's bring it home, more home now. You know, when we talk about policies and we see the interventions that the government is, carrying out, because at that health conference, the minister said a lot of things, some of the things that are on their way, the health infrastructure, the new things that will be introduced in the health sector to help all of this. But we know that it goes beyond the policies. Now, when we want these policies to work, we know that the government also has a major part to play. The citizens has a major part to play. But for the government, how have they made this environment conducive enough for the behavior of these people to change? Because we talk about behavioral change. We say, if you don't want to have malaria, the potholes in your area, you need to, there's stagnant water, you need to do that. But you know that it goes beyond the people being able to do what they can do. I mean, there's only so much that the citizens can do. There's a part of the government. What contributions can they make to ensuring that the environment is conducive enough for people to adopt these health suggestions that you have talked about? You say we should move away from the curative measures to the preventive measures. How can the government help?
Okay, thank you very much. You could cast back your mind to remember at that Medin Commemoration Day,
Okay.
that the coordinating Minister of Health
Yes.
made it publicly, announcing the state governors, all the state governors, all the local government chairmen, that is those already inaugurated on the spot, those that had promoted health to a level of recognition. All the gatekeepers, that is our traditional rulers, the gatekeepers, we all know, the youth, the representative of the youth, even the people living with disability, they were not also left out. He now made these people to be champions and ambassadors of health promotion, meaning that government has already given the leverage that it is everybody's business. So let us now move to the community. And the way you cast back your mind, thinking about a health sector wide approach, this is a medium through which government wants everybody to key into the activities of government and partners. That is all of us. Look at you are media. Through the media, we are now bringing every message to everyone about health promotion. So I think a government is
doing what they can by inaugurating those people.
Yes, and all other sectors. All others. For instance, we have One Health in Nigeria. One Health, it comprises both Ministry of Education, Agric, Environment. That's health. For the fact that government has designated itself to ensure that we achieve that's a SDG, that is Sustainable Development Goal 3 in Nigeria. In fact, government is really flying. How much more this current governor, this current government, especially in line to our present coordinating Minister of Health. When you come to our ministry, they don't sleep. My head of department, she doesn't sleep. The permanent secretary, she's an indefatigable woman. Likewise, our minister, you can see all the programs ongoing. Even the recent concluded joint annual review of the health sector, even the DHIS data, they are out, and you can see how we improved the maternal health care and neonatal child care. So thank you. Let me stop here so that my colleagues will.
All right. Okay, you have something. Let's hear you.
In addition, one of it is why we are here.
Okay.
To educate
the public.
It's one of the strategy that government is trying to put in place to ensure that we ensure this health literacy. And then, if you can remember, when they started the swap approach, government is also doing so much on that area to ensure that they prioritized health promotion. If you look at that swap, one of the initiatives is dedicated to health promotion, driving health promotion in a multi-sectoral way.
Yes.
And then we also, government also put in place a technical working group, that is Health Promotion Forum, to ensure that we collaborate with all sectors. All sectors, including private sectors, to ensure that health promotion is taken down, is moved from the higher level
to the
community. Yes, to the community. And also, government are also doing a lot in terms of policies. They are putting policies in place to ensure that they create enabling environment in terms of policy for development partners, private sectors, even the other sectors. And then we are also doing a lot on SBC,
social behavioral change
materials, to ensure that the populace, once they pick it up, they'll be able to, understand how to go about their health. And then they also work more on capacity building. They are also trying to build the capacity of the health providers and other gatekeepers in the community, the community mobilizers, because they are the first contact with the community. They are also doing a lot in collaboration with partners.
Exactly.
Just as my director earlier stated, that we don't do it alone, but with partners. A lot of them are going into the community to ensure that health promotion is and health item, health agenda, where someone can just stand up now and then say, "Oh, I don't want to be healed. Therefore, I need to do this, do that."
Prevent
Thank
myself.
you very much.
Thank you so much for these contributions. Gentleman in the studio, he's been so quiet. What's happening? Yeah, let's.
Ladies first.
All right. Okay. So now, after the commemoration of the Maiden Health Promotion Day and the third National Health Promotion Conference, what are your expectations from Nigerians regarding health promotion?
Okay, so the expectations are huge, and it is everyone's responsibility to see that happen. First, on the part of partners working with governments like ours at MSI Nigeria. So we go there, we work in the field basically. So we go down to where the people that need to change these things are. Like I always say that it's a behavioral change. Health promotion is a behavioral issue. So behavioral change is at the heart of everything that you're going to do in terms of shifting, the health awareness and consciousness in the minds of people. So what do we do as an organization? In the field, we have a lot of social and behavioral change communication officers who go to the deepest part of Nigeria to meet those people who are the people that we talk to, sensitize them. Education is part of it. We educate them. What people don't know, they cannot do. You educate them, sensitize them, answer some of their questions. Where they have issues around myths and misconceptions, you deal with them. Where they have social norms that are being barriers to their health, their health practices, you address them, and you also direct them to places where they can also find further help and others. So it's
and
about
also feed you have a return feelings and the results of what you have implemented.
Exactly. So it's a loop, and everybody is carried along. The traditional rulers, the religious leaders, because they also hold a whole lot of influence on the people. So this is the task ahead of us to even go deeper. The government has done their own by bringing together and declaring the day. So we are now going to the grassroots and partnering with government and partnering with other organizations to now take this message and begin to drive it home that health promotion is very important in terms of for any changes that will happen in our health sector.
Exactly.
And that's the task ahead of us.
All right, beautiful contribution right there. Now let's go over to you, Ma. Where do you see health promotion in the future?
Wow, that's an interesting question. Yeah, with the collaboration, and because you can't do it alone.
Obviously,
government cannot do it alone, because most of the time in Nigeria, everybody will be calling government. When we have much, we're supposed to be the people that contribute most, even the development partners. So now in future we are going to see that there will be a reduction of that is a treatment aspect of health, more than as we are that is asking people to key into preventive health care. In the sense that even at we know we have 3 levels of healthcare in Nigeria, but the moment we now key into health promotion, that is the primary aspect of it is already captured. So in future, we are looking up to seeing health promotion, that is health of everyone, to improve. Yes, to improve.
Okay, tell us, where do you see health?
So health promotion is hinged on behavioral change, and like I already mentioned, everyone has that responsibility. And as we begin to identify the fact that there are steps to which these changes would happen, because different Nigerians are at different points when you look at it around different health issues and health conditions. So where do I see health promotion in future? I see a Nigeria where preventive health is prioritized and has now become something that we all really are looking up to and ensuring that we are getting there. And when we have that in place, you can be sure that yes, curative treatments and all that will reduce, but that in the long run also reduces the burden of disease. And it just clearly shows that we have the responsibility to see this come true.
Okay.
Yes, and to add to what I had earlier said,
Okay.
I am seeing Nigeria in future where everyone embraces embrace vaccination,
Okay.
immunization. You could remember during the national immunization programs,
Yeah.
we used it to save many souls, our children. So I am equally seeing Nigeria where there will be reduced hesitancy of misinformation and disinformation, because when people are being educated, the literacy level is improved. Everyone will now hear and know, and not that misinformation everywhere. So people will embrace even vaccination, immunization.
Okay, let's hear from this angle.
Okay, thank you very much. So in future, I emphasize a country where the populace can take decision about themselves, about their health. Health promotion, when we talk about ensuring health literacy, we are looking at someone being responsible for themselves. They know that they are not well. Whether they are well or not, they can stand up and they said, okay, let me go for screening, like preventive.
Exactly.
Let me see how my system is working in order to prevent
Whether they are down or not.
Exactly.
whether they are down or not. Yes. So I'm emphasizing the society where youth are healthy and productive, because you can only be productive when you are healthy.
Exactly.
All right.
And then where the society where we take SB, social and behavioral change seriously. You know that when we talk about SBC, social and behavior, it's not automatic. It's
Gradual.
a process. So we want to see in the next 5 years we should be able to stand and then compare Nigeria with other countries that are prioritizing health promotion.
All right. Thank you so
All
much.
right.
1 minute.
For me, our local proverbs, you must find the saying that prevention is better than cure.
Exactly.
Right? So that goes to show how important it is for us to take charge of ourselves, of our health. And in Nigeria, we have a growing and a huge population of young people. Looking at a healthy country to be that country that is not in the hospital, but that country that where people will be able to take charge of their health and be able to do things to stay stronger and productive.
All right, people, we already heard with the proverb you said, prevention is better than cure, but I wonder how come we never ever prioritize that proverb where they say prevention is better than cure. We just say it, we never really do it. So this is a call for you to abolish that habit of thinking that it is sinful to go to the hospital or it is against your tradition. I have never gone to the hospital for 5 years. You are a risk. You are at risk because whether you are down or not, I think we boast about the silliest things these days. Someone will say, since they gave birth to me, I've never gone to the hospital, which just means that you don't prioritize your life. If you do, you go for periodic checkups, whether you are down or not. And I'm sure that this is the entire gospel that they've come to preach to us in the studio today. Thank you so much, Ma, for joining us. Thank you to everyone who has been in the studio so far. All right, guys, we'll be heading out right now. And when we come back at the afternoon, just as we've catered to your psychological and your physical well-being, we will be taking care of your career and your professional well-being on the workstation. Keep it locked in here. This is Martha again, and I definitely will be right back.